The views expressed on the following program do not necessarily reflect the views of Money Radio staff, management, or advertisers, and do not represent an offer to buy or sell any securities. Some interviews heard on this program may be sponsored by the participants. It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. It is Friday, March the 19th, 2021. We're coming at you live from the Money Radio studios in the Scottsdale Air Park at 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. And if this is the first time you've tuned into our show is about how our older adult population can live a healthier, happier life. And how do we do this? We do this by bringing great guests to the show. And today is no different. I'm bringing a really great guest and a good friend of mine from the home care space, Stephen Tweed. He is a partner in a company called Leading Home Care. It's a Tweed Jeffries company. It is owned by he and his spectacular wife, Elizabeth Jeffries. And Stephen, you and I have known one another for probably the better part of 16, 17 years, and it is great to have you here on the show today. Welcome, Stephen Tweed.
Well, thanks, Bob. It's always great to be with you, and I appreciate what you're doing for the community there in the Valley of the Sun and all the people that you touch, not only through radio, but through your work with Cypress and caring for the elderly.
Well, and I said you and I have known each other for a long time. You and I got acquainted, and we were talking prior to the show. I think it was in 2007 when we both were standing up on the lectern together, and we were speaking to probably a couple thousand people from the National Association of Home Care and Hospice. And I will say to our listeners, I've learned a great deal from you. I was impressed when I first met you. I think it was in 2005 at a Decision Health conference in Las Vegas, and you're an incredible orator, a great speaker, and a great resource for the home care companies that are out there in terms of trying to figure out how to be relevant in a extremely relevant time. And certainly these times are quite different than they were back in 2005 and 2007, I'd say.
Well, that's for sure, and there's a whole lot of new things happening in the industry that I think are going to have a very positive impact for elderly folks who want to stay at home, who want to age in place, and yet who want to have high-quality care that will enable them to have, quality of life and peace of mind and independence in their homes. So it's an exciting time.
It is an exciting time, and because you've been in the industry for so long, you are often sought out as a consultant, as a speaker, as an advisor. You've shared with me a lot of private equity companies and venture capital groups, commercial banking. They reach out to you so they can learn more about the space that really there isn't a whole lot of knowledge out there. I mean, we're talking about the in-home care space, which is oftentimes confused with home health, which are very, very different. And for our listeners, home health is more clinically based, and in-home care is direct in-care space. And I'm talking about assistance with activities of daily living. And for those that don't know what those are assistance with going to the bathroom, getting dressed, meal preparation, driving to appointments, medication reminders, and so much more. Stephen, I asked you to come on the show because you have been not only a great friend of mine, but a great resource for home care companies like my company, Cypress Home Care Solutions. But you've also seen so much change that has happened. And one of the things that we are all challenged with, and when I had Todd Laporte here on the show, the president and CEO of Honor Health, he made an appeal about trying to get people into the space. And prior to the pandemic, we knew that we had a caregiver shortage. Matter of fact, you wrote a book on the caregiver crisis. I would love for
I
you.
did, yeah.
I'd love for you to talk a little bit about that. But things have changed even more with COVID.
Yeah, it's been very interesting, Bob. Obviously, the nursing home crisis, where so many residents in nursing homes passed away as a result of COVID, and in other senior living communities and assisted living and independent living, and so it created that I guess fear on the part of elderly folks and their family, their primary family caregivers. Don't mind me, I'm a professional speaker. The primary family caregivers about having their loved one in a facility. And so that caused them to look at and explore the growth of in-home personal care. And what we saw, and you probably saw it there in the Valley, the established home care companies that had relationships with hospitals, with nursing homes, with home health agencies, further developed those relationships, and the small companies that weren't as firmly established saw their referrals fall away. And so what we see is clients being referred to home care companies that are established, that have clinical protocols, that could get the personal protective equipment, that could do some of the clinical things in caring for clients with COVID. And so we're seeing the larger companies strengthening and the smaller companies sort of struggling. And then you add the caregiver recruiting and retention crisis on top of that, makes it difficult for all of them to find caregivers. But the established, stronger companies are able to find the people that they need to serve their clients.
You know, I mentioned your book, and I want to just back up a little bit, because you have a book out there that's out there on Amazon, and it's kind of like the holy grail as it relates to the caregiver crisis. And I would love for you to talk just a little bit about it before we finish this first segment, and then we can jump into what has happened with COVID and how the dynamics have changed.
Well, the book is called Conquering the Crisis, Proven Solutions for Caregiver Recruiting and Retention, and it's really written specifically for owners and CEOs of home care companies across the U.S. and Canada who are facing this crisis. And as you know, Bob, we lead a series of home care CEO mastermind groups. These are small groups of 10 to 12 companies that meet together twice a year, face-to-face, and once a month by video conference. And their big burning issue is finding and keeping caregivers. And as you said, part of it is, how do I make my company more attractive? How do I create a culture, a great place to work where people want to stay with my company? But the other part of it is, how do we as an industry attract more individuals into healthcare as a profession? Whether it's nurses and therapists in the hospital, whether it's CNAs in a skilled nursing facility, or whether it's home care aides working for us in home personal care. We need to communicate the message that this can be a great place to work, that we're doing meaningful work, making a huge difference in the lives of these folks that we're caring for and their families. As you know, I have an adult son who's disabled, lives in a wheelchair, and uses the services of home care on a daily basis. And Jason's married and has twins that are 18, and he has his own business, so he's really independent, but it's the caregivers that help him with his activities of daily living that enable him to live independently. And we know that it makes a difference for Jason, but it makes a huge difference for his family. So your listeners who are the primary family caregiver of an elderly person can understand that home care can make a huge difference, not only in the life of mom or dad, but in their own personal life as well.
So true. And for us that are providers of these services, caregivers are truly our only asset. Without our caregivers, we have nothing. And we have to, like you said, we have to be able to track them. We have to have the right culture, the right environment. And it's not always about pay. It's about making it a rewarding experience, because truly that's what it is. It's helping your fellow brother and sister out and giving them that ability to remain independent and in their own home. We're down our first segment, Stephen. You got Coldplay taking us out. Thank you to James. We got 3 more segments with Stephen Tweed, Please stick around. You're listening to Health Futures, Taking Stock in You. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You, and if you're just tuning in, I have got Stephen Tweed. He's coming in via technology and the telephone. Stephen Tweed is the owner, or should I say founder and owner of the Leading Home Care. He shares that company with his beautiful wife, Elizabeth Jeffries. It's a Tweed Jeffries company. He also is a founder of a home care CEO forum, and he also has a number of different mastermind groups within the home care space. I think it's, and Stephen, correct me if I'm wrong, it's a top like 3%, 5%, 7%, 10%? Did I say?
Yeah, we have 4 groups, top 5, top 7, top 10, and then a group called Strategic Growth, which is newer, smaller company.
And really, it is all around the in-home care profession and really helping them work through problem solving, sharing of information. I was a member of one of his masterminds, and everything that happens in that room and in that setting stays in that setting. So it's really nice to be able to share some of the challenges that each of us have been dealing with. And what we talked about in the first segment was we talked about caregiving. And we talked about how challenging is finding caregivers. And Stephen, prior to the COVID pandemic, he wrote a book, Conquering the Caregiver Crisis. And it's a I was going to say New York Times bestseller, but it's a home care bestseller, and it's one that could be found on Amazon. But I want to take this time in the second half to really talk about, or the second segment, talk about COVID and how we are looking to, really do more to create a space where people can come into and learn a great craft, and that is to learn how to care for one another. This is a great entry-level position in home care, and because of this pandemic, the need has just grown even further. I think that Seema Verma, who used to be the CMS administrator, that's the Centers of Medicare and Medicaid Services, she said last September, the traffic devastation wrought by the coronavirus on nursing home residents exposes America's over-reliance on institutional long-term care facilities. Residential care will always be an essential part of the care continuum, but our goal must always be to give residents options that can keep their loved ones in their own homes and communities as long as possible. And that was an endorsement and a spotlight that was shown on home care. And the biggest challenge we ran into with the pandemic was the fear of getting the virus from home care workers. We had home care workers that were making more money, collecting money on unemployment. And then we also had the sheer fact that schools and childcare was put on hold, and a lot of these care workers couldn't work because they needed to be at home.
Yeah, it was a real difficult challenge, Bob, but it was very interesting to see how home care companies, and they're very resilient, their leaders are amazing, how they quickly adapted and adjusted to the current reality. They found new ways to attract people into the industry who were not able to work in other industries like hospitality and the restaurant business and the travel industry. And what I think attracted people to home care and caused many of them to stay is doing meaningful work. These caregivers make a huge impact on the lives of their clients. They develop a chemistry with their clients. And what we've always observed, and my son Jason called this to my attention 20 years ago, he said when the caregiver and the client develop a chemistry, develop a relationship, they both stay together longer because it's a mutually beneficial relationship. And so when we look at the caregivers who have been working in home care for 10 or 15 or 20 or 30 years, as you know, they're not doing this because of the money, because nobody's going to get rich being an hourly caregiver. But they do it because they know that it makes a difference in the lives of their clients. And they have that personal fulfillment, and which is true with most healthcare workers, with nurses and therapists. They don't do it for the money. They do it because they know they're making a difference in the lives of another person. And then you take these hourly in-home caregivers, and then the second thing that we find causes them to stay doing this work, and this is hard work. You know, it's easier to make money flipping burgers or doing some of the other things, and with the $15 an hour minimum wage coming, it's going to be more difficult. But the people who really see themselves as a professional in caregiving and are doing this meaningful work want to feel valued and appreciated. And when they feel valued by their clients, so when clients tell them thank you, when they send them a personal note, when they write to the company and say, Sally was such an incredible caregiver, they feel valued. Then when they feel valued and appreciated by their immediate supervisor. So as you know, the team members that you have that reach out to those caregivers and let them know they're appreciated. And then as a company owner, when the company leadership lets caregivers know they're appreciated, we find that they will keep doing what they're doing. And it's interesting, in some research that we did of 7 factors about why caregivers stay with a home care company, feeling fairly paid was number 7 out of 7. And so these folks really do this because of the personal fulfillment that comes to it. So as you were talking about your listening audience out there, if there are people out there that want to do something meaningful and make a difference in the lives of others and who want to feel valued and appreciated, there's no better way to do that than in-home personal care. And the pay is not bad. It's good. It's reasonable, and it's growing. And so people can earn an income by doing this important work.
And, you know, like you said, it's meaningful, but it gives you a sense of purpose. And the other part, too, is that it's one-on-one. It's not 1-on-7, 1-on-10. And you get to really know the person. You know, I had a caregiver once say to me that every one of her clients is like a good book. They all have a great story, and they feel like, you know, once they've heard that story, they feel like they've almost become part of their family. And and as much as the care recipient relies on the caregiver relies on the care recipient. And that, as you just said, that bond is really, really special. And don't get me wrong, as an agency owner, we do have caregivers that come in and off of our platform in 90 days, 120 days. But we have caregivers that have been with us for over 10 years. And, you know, we have clients with us that have been with us for 10 years or more or less. And those caregivers typically stay with those clients because they are part of that extended family. And it's really special to watch. And, you know, I'd be remiss if I didn't take this opportunity to make this appeal to our listeners. If you are one of those folks that is a caring spirit that wants to make a difference in someone else's life, and you have the time, please search out home care companies like Cypress Home Care. You can call us at 602-264-8009. We're looking for people that want to make a difference in somebody's life. And if you know of somebody that is in between careers, maybe it might be graduating high school or college, this is a great entry level to get into the healthcare vertical, because I've had so many caregivers that have joined our company that have progressed onto different positions within the care continuum. And I'm talking about nurses and physical therapists and occupational therapists and speech therapy who started out just as a caregiver. And I don't want to say just as, because the work that caregivers do is extremely meaningful.
I agree completely. And I, too, have seen a number of folks who have started out as a caregiver. One of the things that we learned from our research into caregiver recruiting is that an excellent place for a home care company like yours to find caregivers is in a 4-year school of nursing, where you have nursing students who have already made a decision that they want to care for others. They're going to class, and maybe they want to earn some extra income, and they want to practice some of their hands-on skills. We find that nursing students make excellent caregivers for the time that they're available while they're going to school. But then as they go on to a nursing career, working in the hospital, working in a skilled nursing facility, working in home health, they also make a good referral source for that home care company because they remember the impact that they had on that elderly person, and then they know that that other caregiver at Cypress is going to go in and make a big difference as well.
You know, you talk about these nursing schools, and obviously the landscape has really changed in the last year. You know, the last time I was on a plane was when I saw you in Austin, Texas, leaving on March the 12th when you left as well. And,
That's right.
And I've not been on a plane since. And, you know, how different our world is. And I will tell you, we don't have that opportunity to go in front of nursing schools any longer. And there's never been a better advocate than one of our caregivers who graduated the nursing school. And we've done that with our recruiter going back into the school and speaking to new grads and having that caregiver who either just recently graduated or was graduating along with our recruiter talking about the great work that they do in home care. Well, it's hard to believe we're down our first half, Stephen, and I want to, when we come back to the second half, I want our listeners to know a little bit more about you. So I'm going to put you on the spot to really talk about your background and who you are and really how you got so, you know, passionate about this space, because you are passionate about the work you do and you're passionate about the in-home care space. You've been listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. I got Stephen Tweed here in the studio, coming via technology and telephone. Stick around. We're at halftime. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth. We're in our second half here with Health Futures, and if you're just tuning in, I have Stephen Tweed. He is the founder and co-operator of Leading Home Care. It's a Tweed Jeffries company with his beautiful wife, Elizabeth Jeffries. He also is a consultant. He publishes books, and he leads mastermind groups and does a lot of public speaking, a lot of other things. He led a group called the NSA, and that's not the National Security Association, wherever that is. It's the National Speakers Association. But I let a little tease at the end of the second segment and saying, you know, here when we get back to the third segment, I would love our listeners to know a little bit about you, Stephen. So if you could just take a few minutes and tell us a little bit about you and how you got so passionate about the space that we're in and the space that you're in as well.
Well, thanks, Bob. This is a space that draws you in and attracts you. And I started my speaking and consulting business back in the early 80s. And like a lot of professional speakers, I was very clear about what I would do. I would do anything for anyone at any time for any amount of money because I needed a check because I had these 3 children that wanted to eat, and I was trying to figure out the business. And we began to work with a lot of different kinds of organizations. But one day my phone rang, and it was my pastor from the church in the small town I was living in Pennsylvania at the time. And he had been elected as chairman of the board of the local visiting nurse associations, a home health agency, and hospice, but also had a private pay home care business, and asked if I would do some strategic planning. And I'm thinking this is a pro bono opportunity. It turns out it's a real organization with a budget. And I went in and did some work with their board, and the CEO was an amazing woman who was a nurse and an industry leader. And you would probably have run into her at the National Association for Home Care and Hospice, but she liked what I did, and we connected. And so she introduced me into the home health care industry with other agencies in Pennsylvania, then to the State Association, and then to the VNAs of America, and then to the National Association for Home Care and Hospice. At about that same time, I was dealing with my own life situation in that in 1971, I walked into the office of a world-renowned pediatric neurologist in Pittsburgh, Pennsylvania, at Pittsburgh Children's Hospital. And we walked in, and it was a dark, gloomy office, but then he was a dark, gloomy doctor. And he said to us, I believe your son has a rare neuromuscular disease called Wernicke-Hoffmann syndrome, anterior spinal muscular atrophy. He said, I believe your son will probably live to be 3 or 4. Take him home and love him. Well, obviously, that's not the message that any parent wants to hear. But back then, we did what the doctor ordered. So we took him home, and we loved him, and he got to be 3, and he got to be 4, and he got to be 6, and he went to kindergarten. And we worked hard to mainstream him in school and elementary school and junior high school, and went on to high school and graduated at the end of his 11th year, and went on to college and graduated after 3.5 years, and then came home to live with Dad, who was by that time a single dad. I don't know how many of your listeners have had that experience. You send your kids off to college, they come home, they stay, you can't get rid of them. And so Jason and I teamed up, and Jason is now 50 years old. He worked with me for 10 years at Leading Home Care, then started another company doing digital marketing. He has twins that are 18 years old. His wife is a social worker, and he has used the services of in-home personal care for the last 30 years since he got home from college. So it's a true testament to the power of personal in-home care, but it also is a testament to the impact that home care has on the lives of the family. And certainly those caregivers made my life easier, his wife's life easier. It's made it able for his children to live a somewhat normal life in spite of Jason's disability. So that's what motivates us, because we realize the impact that you and companies like yours have on the clients that you serve, but also on the caregivers that you employ. I mean, you're creating a great job opportunity for people who really want to make a difference, and you're paying them a fair wage, and you're giving them an opportunity to learn and to grow. And so this business really makes a big impact. And because it's a highly fragmented industry with lots of little tiny companies, it is not as well known as hospitals and nursing homes and home health agencies. But home care is huge, and we love what we do.
You know, I love your story, and I think so many of us that are in this space are in it because of our personal experience, like you. It becomes a calling, and certainly you and I both know we could make a whole lot more money doing other things, but we do this because our passion bucket is overflowing, because we make a difference in the lives that we serve. I would love for you to talk.
Well, you have your story, Bob. You know your story, taking care of your mom and your father and your brothers in the business. Every home care owner that I know that I work with has a story. There's some personal connection. It's been caring for a father-in-law. It's been caring for a mother. It's been connecting with some person who has a need, and the stories are amazing. And that's what makes this industry so amazing, and what makes the industry such a value to folks like your listeners who may be concerned about an elderly parent. Maybe they don't have a need right now, but a year from now, 2 years, 5 years from now, and just knowing that home care exists, knowing that companies like yours exist that they can call on when that time comes. And there's a lot of data that shows that, you know, most of us, if not all of us, will need some level of assistance as we age. And there's the data that shows what percentage of elderly people go into nursing homes. But then there's a lot of people that don't have to go into a nursing home because they can receive that care in their own home. And that's the difference that we make. And that's why we love doing what we do.
We do. And we definitely do. I did leave a little tease about NSA. Tell us a little bit about NSA and how you got involved in doing public speaking.
Well, the National Speakers Association is an association based right down the road from you in Tempe, Arizona. And it was formed in the early 70s by a gentleman from Phoenix by the name of Cabot Robert. And he formed this club of people who were out speaking professionally, and it grew into an association of 3,500 individuals who earn all or a portion of their living speaking at association conferences and corporate meetings. And I was drawn into it when I started my speaking business by a friend and colleague, and attended my first national convention in Phoenix in 1986. And it was just like being home. You mentioned going to the home care conference and knew that you were home. When I went to my first National Speakers Association meeting, it was coming home. And my career grew as a result of the people there that shared their insights. And then in 1990 at the convention, I met my wife, Elizabeth, and she was speaking and I was in the audience, and we talked afterward. And she was in Louisville and I was working with the hospital there. So I went to Louisville for work, and we had dinner, and as they say, the rest is history. So I tell people this association will change your life. And I'm big on associations. You're active in home care associations, as am I, active in my National Speakers Association, because coming together with other people who do what we do and sharing ideas and supporting others. We call it the spirit of Cavett, after Cavett Robert, because he was such a giving, caring person who helped all of us grow and learn and get better at what we do.
And certainly these mastermind groups that you've created, they're micro associations, and they're wonderful to be able to come together and, like you said, feeling like your family. You know, there's so much still I want to cover with you, Stephen, and I want to give just a little tease for our last segment, and that is I really would love for you to share with our listeners what factors consumers should really think about in considering when selecting a home care agency. And nobody knows that better than you do, because you did this 40 years ago with your son, Jason, and I would love to hear what factors you should be considering. You're listening to Health Futures, Taking Stock in You. I've got Stephen Tweed. He is going to be back for one last segment. Please stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our fourth segment. I got Stephen Tweed here in the studio, actually via technology and telephone. If you missed the first three segments, go up to our website at cypresshomecare.com and click on the media button. Third button down is radio show. You'll catch this show and about 400 others we've been bringing to you for the last 8 years. We have talked about a lot of things, Stephen, and we talked a lot about your background and your personal life and how you were a consumer of home care services for your son, your disabled son, who is incredible, and I've met him. Beside being in a chair, that's about the only thing he's disabled in, because he cerebrally, he's very brilliant and very smart, and he's got two beautiful children that I've seen pictures of with you. I know every summer you guys, and it's a trip that you just take with the grandkids. You go somewhere, and Stephen, where are you going this year?
Well, that's a good question, Bob, and we're still working on that as we get out of COVID. We missed our 2020 trip. The year before that, I took the boys. I take my three oldest grandsons, and now we've got a fourth one that will be joining us. We went to Toronto, Ontario for a week. The year before that, we came out to Phoenix and went to the Grand Canyon. The year before that, we went to Yellowstone. Not sure, it'll probably be a quiet little cabin in the woods in central Pennsylvania. But, family time is important, and that's one of the things we love about what we do is we place importance on family and are able to carve out the time to focus on the kids and the grandkids.
So true, so true. So I left a tease on the third segment at the very end, talking about, really, being a consumer of caregiving services. What should consumers really consider when selecting a home care company like Cypress? Because you've been in that position and you work with home care companies. I'd love for you to maybe give our listeners just some tips to the trade, some insight as to what they should be looking for.
Well, that's a good question. And I think it begins with the consumer studying the company and learning a little bit about the owner. What I've seen is that the culture of the company, that is the way we do things around here, is set by four things. And the first is the leadership style of the owner. And so getting to know about Bob Roth, and you will know more about Cypress. The second is to understand the culture of the company, and that is, what are the core values that guide their thinking? And the really strong home care companies we work with have clearly articulated what they believe, and they communicate that to their caregivers. And then the third element is, what's the behavior that you expect? And then fourth is, what's the behavior that you permit? And so as a consumer is looking at a home care company, getting to know about the company, who owns it, is it a local company? If it's a franchise, who's the local franchise owner? Healthcare is a local business, and there are some big national companies, but it's a local business. I think then the next thing to look at is, what is their ability to find and keep caregivers? And everybody's facing a crunch, but the better, stronger companies have a process in place to regularly recruit new caregivers and to retain the caregivers that they have. And so a company that's a revolving door that has constant turnover is not going to give you the continuity that you want. As we've talked to consumers of home care, both clients and family caregivers, the two big things they want are, number one, reliability. We want the caregiver to show up on time when they're scheduled. And then the second is continuity of care. Consumers want the same caregiver every time. And so in talking with the folks at the company about their caregivers, do they have a solid core of caregivers who are reliable, who will show up when they're scheduled, and who will stay with that company, and therefore you have the continuity of care that you want? And so asking good questions, asking for examples, asking for testimonials. Do you have a family that would be willing to talk with me about that and do some background checks or checking references? Because word of mouth is the best way for a home care company to grow a company, and word of mouth is a great way for consumers to learn about the local home care company. Obviously, on the internet today, a lot of people are looking at reviews, and they're reading reviews because those reviews are coming from real people who have had an experience with that company.
Sage advice. Really, really good advice. And certainly, I love how you talk about it being local. And there's one word I typically talk about it, and it's about trust. I mean, listen, a care recipient, when they open up their door, they open their life to a caregiver. And you have to trust them. And you don't know who that caregiver is, but I love your point. Find out who that agency owner is. And it could be a franchise owner or it could be an independent, but find out who they are and dig deep to see if in fact, they are trustworthy. And all those online reviews, but I also do love the fact that word of mouth and calling to check references are definitely something that people should be doing. This is something that is so critical to families. They need assistance, and you want to make sure they get the right assistance. Unfortunately, we hear too much about the bad, but there's so much good. And I also want to give a plug, and something you talked about, people that are members of trade associations, whether it be the Home Care Association of America or here locally, the Arizona In-Home Care Association. I mean, those are there are standards that these agencies have to follow. So, Stephen, I learned a long time ago from you that you do lightning rounds with people, and we have just about a minute or so, but I wanted you just to respond to a couple things I want to throw out to you.
Okay, we'll do that.
You ready for it?
I'm ready.
All right, vaccinations.
We've got to encourage caregivers to be vaccinated. Obviously, we've got to encourage the elderly to be vaccinated. We've got to conquer this COVID crisis.
PPE.
This is a real shocker when the COVID hit and we realized we didn't have enough personal protective equipment. I think we're in a much better place than we were a year ago, but we always need to be aware of the need for that.
Medicare Advantage.
Medicare Advantage is an interesting phenomenon where insurance companies and the federal government are now beginning to recognize that home care, in-home personal care, is a valuable part of the healthcare continuum. And so I expect over the next 5 years or so that more and more Medicare Advantage plans will be offering in-home supports and services as one of the benefits of their plan.
Fight for 15.
You know, the $15 an hour minimum wage thing is something that I personally am troubled with because I'm not sure that it makes sense for the government to dictate that. And we know some of the consequences of that. We watched what happened in Seattle, Washington, when the minimum wage went up. And for example, one of the first things we saw was caregivers calling their agency saying, I need to cut back my hours because I'm making too much money and it's going to impact other benefits that I have. The other thing that's going to happen is states, probably like Arizona, are going to be in big trouble because if the minimum wage goes up, but the state legislature doesn't increase the reimbursement rate for Medicaid, in-home personal care, or other Medicaid services, there are going to be consumers who go without care because they can't find caregivers and they can't find agencies who will work with the Medicaid population.
Last question as we end. Caregiving in the future.
I think that there's a huge opportunity for folks who really want to care for others, and there are millions of people in America. This is a great country built on taking care of other people on a voluntary basis, not having the government do it, but doing it through our churches and our synagogues and organizations like home care companies. It's an exciting place to be.
Loved having you on the show. I don't know why we didn't do this sooner, Stephen. You're a wealth of knowledge, and I really appreciate you sharing a lot professionally what you've learned, also personally what you've learned. So I'm wishing you and Elizabeth a great year. Make it a great day. Have a great weekend. Stephen Tweed, thank you for joining us here today. You've been listening to Health Futures. Take care.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.